I'd like to start by asking you how you got to Brompton and why.
I started my career in paediatrics and in cardiology in Leeds. And then I became interested in paediatric cardiology and moved to Birmingham. And whilst I was in Birmingham, there were several landmark publications in heart disease coming from the Brompton at that time, from Elliot Scheinborn, Bob Anderson, and Christopher Lincoln. So the Brompton suddenly was a place where things were happening. Later on, having left Birmingham and gone to Oxford and then Toronto, where I had a Canadian Heart Research Fellowship, I then applied for a job at the Brompton when I saw one advertised. At that time there was 6 senior registrar posts in the United Kingdom in paediatric cardiology, so not many. Anyway, I applied for the job in the Brompton and got that job. Subsequently, I went to Oxford in about 1982 as locum consultant for around about a year, and then was appointed full-time consultant at the Brompton in 1983. Brompton was, at that time, a well-known place, as it's remained. It seemed like an interesting place.
What is the first thing that you thought when you came here?
I think the first thing I remember thinking was, having been working in Toronto in a relatively new, well-equipped, big hospital, the Brompton seemed terribly old, which it was, of course, because half the Brompton was built in 1840, and the other building, also on the Fulham Road, was probably built, 40 or 50 years later, so it was a very old building. Everywhere seemed ancient. But also, because it looked so ancient, you did have this sense of history. You felt the sense of history was reinforced by it being so old. In a niche area like congenital heart disease in children, congenital heart disease in adults, it's a small club. There were famous American surgeons who've trained at the Brompton. Denton Cooley became one of the most famous American cardiac surgeons. There were visitors from all over the world, from everywhere. People were visiting the Brompton. So, notoriety is the wrong word, but it was a place that people liked to come to from all over the world, and this reinforced this sense of importance. You look at the surgeons and the cardiologists who worked at the Brompton and at the old National Heart Hospital, which was kind of sister hospitals, the same management. And the cardiologist, Paul Barton, was one of the most famous congenital cardiologists. Donald Ross, pioneering in surgery, was part of the team here as well. All that sort of thing.
That makes me think, surely teamwork becomes important in...
Of course, you're in a kind of a heart institute like the Brompton. There's an expert there on virtually every field of cardiology, every small niche area of cardiology. So within the group, within the team, there are always people that you can ask. For whatever reason, and I don't know what the reasons are, but for whatever reason, the Brompton has always been a very happy place. We call it the Brompton family. Once you've worked here, you're a member of the Brompton family, whether you're still working here or not. There's this very nice feel. Everybody would say the Brompton is a great place to work because of the friendly atmosphere. So that helps the teamwork, and it's always been that from the first day I arrived here. Nothing has changed, and this is in sharp contrast to many hospitals where the atmosphere is not nearly so good. The friendliness just helps the overall teamwork for the patients. The Brompton is one of the best, and that's good for the patients and good for people working in the place. There are all sorts of support groups for people with all sorts of abnormalities to get together to discuss their problems. If you happen to have chronic disease, to meet other people living with the same disease and to discuss your mutual problems is also therapeutic for people. Or to have people telling you how they're dealt with particular problems. So the Brompton provides a lot of those. So that's important, I think. I'm involved in this Brompton Fountain charity, which the chief executive is Trudy, and Trudy does a fantastic job. And this is a charity to support parents and families predominantly when they're in hospital. The charity is there to give financial support, psychological support, families in hospital, to parents mainly, also the children to some extent, but it's to the whole family. And Trudy did all sorts of things like organising pizza evenings and social events in the evening for parents in hospital with their children for whom life can become pretty boring and stressful. So to have events on a regular basis which take away some of that stress, or to do simple things like we provide washing kits for people, toilet kits and all sorts of things that people might not have because they've only just arrived. Anything to make the process easier, a bit less traumatic is good. And it's a very successful charity, raises quite a lot of money every year.
There's a lot of talking about the NHS and where it's at and what's going to happen in the future. What's your opinion?
The NHS basically works. It's a great story because people get free healthcare, they don't have to worry about the economics and everything. Probably not many countries do it as well as or better than the UK. Many people in many countries rather envy the British for the fact they've got this free healthcare. I think that the future is not so rosy and the future is going to be very difficult. But there's no other country not facing the same challenges. The problems that we have are clear. An ageing population and money that is for the NHS, an increasing proportion of that is devoted to care of the elderly in the community. So although governments may say, well, we've increased spending on healthcare, it still isn't enough. If I was advising anybody, I would say separate the sort of social care of the elderly from the NHS budget. Don't take it out of the NHS. I think that would be the beginning of solving the problem, perhaps. Unfortunately, healthcare costs do go up all the time because the treatment becomes more sophisticated, more successful, and it goes up at a rate greater than inflation. So I fear that people who are dissatisfied with the NHS and dissatisfied with health funding will always be dissatisfied. So the debate is going to go on and on and on. It's not like, the government's decided to provide an extra 20 million for healthcare over the next 5 years. Let's relax, everything's fine. It's not going to make a huge amount of difference, so people will be slightly disappointed. Maybe people have to then take a look at healthcare provision in other countries and realise, we're doing pretty well in the United Kingdom with what we provide. And many people in the United States have no healthcare. You have to remember that. If you live in many areas in South America, it's the same. There are good doctors, good health providers, but is good treatment available for everybody? No. To have a situation which can occur in many countries where you have to sell your house to pay for the treatment of your child's leukemia or heart disease or something, is not the kind of society that most people want. So this principle of free treatment for everybody when it's needed in a timely manner is still the principle to go for.